Hi everyone, my name is Ryan Sinclair, and I'd like to go over this lecture about personal determinants of health. And so this is the first lecture that we have for the P-Core series on this topic, and it relates to genetics and what influences our health. So oftentimes we'll hear our parents or other relatives say that the genetics is everything, and that's not entirely true. It does make up a significant component. It might not be the major component, but it does in many cases. But we need to think about what else influences our health and what contributes to our quality of life and lifespan. So what I've done is compiled 4 different influencers or influences, and these are the individual, the social, environmental, and policies, and they're all overlapping circles. And so the way I'm going to explain it is that they're all related, but all include different types of things that can influence our health. So this is our faculty view. I met with other faculty here and come up with this, and also the late Dr. Sam Sorad also had something similar to this, and the California Endowment currently uses something like this. And there's some good readings and other videos here that you can use to supplement this, especially the bits about epigenetics and genetic influence on our life. So let's start with this figure. So what this is it's kind of like a blue rainbow of things that influence our health. And so what I have here is the top one, or the bottom one. Let's start with the bottom. We've got the individual, and so things that impact our individual health are our behaviors, and we have agency to do what we want to do, and then our genetics, and we don't necessarily have the agency to do that. So if we're born with a genetic condition that's not reversible, that's it. That's what we're stuck with. But in many cases, we're born with influences that may not manifest themselves, and that's the whole concept of epigenetics. Anyway, so that's the individual circle here, and I have this blue rainbow split up into 2 sides. We have on the left side is the responsive medical side of things. So if we're going to be clinicians, we're going to often deal with this kind of thing. So what we have is on the medicine side is genetics, and then on the public health side, that's what we're trying to do. We're trying to get people to understand that they can change things about their life and about what they're destined for. So they have the agency to change their behaviors. So that's how we split this up, is the left side, the medical community will have to respond to, and the right side, the public health community will have to respond to. Or the public health can be proactive and progressive about it. Okay, so that's the individual component there. The next one we'll move to is the social, which is slightly outside the individual. And the social, this is going to be things like your church and your family, and it's going to have concepts like health for all, which is a public health concept. Also, this is going to be your recreational opportunities in your community. And so those are all things that the public health side are going to help to extend your life and increase the quality of your life. While on the negative side of things, we have with social, there's isolation, there's institutional power that might try to guide you away from the best quality of life that you can have, and that would be a social thing. Also, exclusionary narrative. So if there's some kind of racism or other thing in the culture or the society, then that is something that will come up. And oftentimes those things lead to lower quality of life and have to be dealt with from the medical side. So they have a much more expensive cost. Also, if you look at these 2 things, the things on the left are often much more expensive than the public health preventive programs on the right. So let's go to the next layer here, which is the environment. And that's not only the environment in terms of the natural environment, but it's the environment where you live and where you grow up to be. And again, these are all subjective things that we've come up with. What I've done is, we can compare them. So an environment in terms of infrastructure would be updated, smart infrastructure, things that are new, things that give you opportunities. While the environment for on the negative side would be a minimum public infrastructure. And so that would be something that doesn't work or there doesn't exist, and so you wouldn't have those health protections. So if you talk about things like water and sanitation, you'd have more exposure to poor sanitation in the left side with the minimum public infrastructure, while on the right it would be an updated smart infrastructure with really good sanitation services. Another thing is, on the right side, you're going to incentivize society and youth, and also I have here incubate and incentivize STEAM, and so that is science, technology, engineering, arts, and math. And so, or that commonly as STEM, but in other words, incentivize education. Also, streets, neighborhoods that are complete, this concept of complete streets, you can look that up. Public parks are important for recreation and for just living in a good environment. Those things are all public health side. The negative side of that would be the waste streams, having business zoning for houses rather than family-friendly zoning for houses. Oftentimes those two things don't comply very well. If you have business zoning, like we have in some areas nearby Loma Linda, actually, with San Bernardino and the warehouses, then you're going to have a lot of truck traffic, and you're going to have a lot of big industry there, and that's not necessarily a good place to live. So those things don't comply, and that's all part of this environment. Also, maybe an incentive for free markets with unregulated capitalism would be another thing when you have that, or unregulated industry as well. That kind of goes against social capital investment. Okay, so let's go to the next one. Policies. These are policies that a government would have about different things. And we hear about this daily almost, and all of this really we hear about daily in these four categories. Policies being kind of the upper level of all of this. The main thing that we can talk about here is science policy. So when you have something that could impact your health, you could have something that's for ecological, more of the ecological bent on it, or you can have some science that's more industrial. So how to make those chemicals, for example, or for ecological, how to emphasize a restoration of a lake, or to clean up a lake, or to mitigate some environmental hazard, to make the public health better, while the industry would be primarily for market and for profit. Okay, so then you have things like social justice and equity, economics, and education. Those are prioritized on the public health side of policy. So policy is about equity, environmental justice, for example. Policy is about economics, where you're incentivizing in education again. And so these things are related between environment and policies. But when you're developing the policies, they're called these things on the right. And then on the left side, if you have lower socioeconomic groups, if you're reliant on unskilled labor, in factories, for example, the medical cost of that is going to be much greater. You're also reliant on disparity. So what I've done is I've got these four concepts here, and this is a guide for you. You can also put in your own ideas in this. This is not a closed system. And what I'm often doing in the assignments that we're going to see in this quarter in the P Core and in other things is that I'll have it summarized here, where you have the influence on health as the top, policies, environment, social, individual. And again, the medical side is often the responsive side, and the public health side is like a progressive side or preventive. So you do public health and you try to prevent things before they happen, while the medical side is going to respond. If you've got an industrial spill from unregulated industry, like say the Bhopal chemical disaster, that's going to be a much more expensive medical side. Or say that big factory worker, garment factory in Bangladesh that collapsed a few years ago. People were sidestepping the required maintenance to keep that building up. But because of that, you had a huge medical cost and a huge medical casualty with that. While if you would have, prioritized that kind of infrastructure, you wouldn't have this. Okay, so that's kind of the end of this presentation, but this is just to summarize this personal determinants of health.